Welcome to the Women on Fire podcast. We're on a mission to help you have your best menopause and rest of your life. I'm your host, Jenna Moore. I'm an integrative health menopause coach, and I've studied nutritional awareness, women's hormones through a functional medicine lens, and explored various modalities, including breathwork, mindset, and positive psychology. Join me and my guests as we discuss how to navigate the natural life transition of menopause and growing older, from waistlines, waning libidos, and what to wear now we're over 40. We discuss it all. Women on Fire is sponsored by MenoMe, a New Zealand-based company by women for women. MenoMe specialises in evidence-based, all-natural supplements to support you through every stage of menopause. I'm excited to introduce you to my wonderful guest. Her name is Chelcey Salinger, and she is a certified trichologist and hair loss specialist. Doesn't that sound juicy? Because we are going to be diving into a conversation about the hair thinning, the hair shedding, and the hair loss that can occur during perimenopause, menopause, and postmenopause, and I know can be quite distressing for many of us, and that includes me. I went through it until I learned how to knock it on the head, which I will also be sharing with you at a later date. But more importantly, or most importantly as well, we'll be chatting to Chelcey about what you can do about it. So Chelcey is, to give you a bit more background on Chelcey, she is a consultant trichologist at the Australian Trichology Centre in Sydney and Adelaide. She specialises in hair loss, baldness, alopecia areata, which is that condition where you can lose your hair due to a variety of causes, I think. Perhaps you will talk a bit about that today. Hair breakage, hair damage, and psoriasis and other scalp conditions, because sometimes it can not just be about our hair, but also about our scalp. But it doesn't stop there. Chelcey is also the executive director of the International Association of Trichologists, and they are based in the USA. So she is also involved in the education of up-and-coming trichologists, tutoring students all over the world, and as well as that, she supervises the clinical training and experience of trichologists in Australia. And I do believe if a New Zealander decides what they want to be a trichologist, they go there to train as well. Chelcey also has a strong background in health, because she also holds a bachelor's degree of human movement and health and a master's degree in occupational therapy. So we're very fortunate to have Chelcey on Women on Fire today, and we're in very good company because her opinion and knowledge is sought after both in the media and at international conferences, and she's spoken at many trichology conferences all over the world in places like England, Brazil, Iceland, and Canada and Ireland. So don't you just love being able to gain knowledge from experts? I know I do, and I think we're very fortunate in this world of vodcasts and podcasts that we can do this. Hi, Chelcey. Thanks for joining us at Women on Fire today.
Thanks, Jenna.
So first of all, as we dive in, can you explain to us exactly what a trichologist is?
Yeah, a trichologist or trichology is really it's a paramedical field. So we're not necessarily medical doctors, but we certainly have learned about all of the evidence and know how to read research and literature regarding hair loss and scalp problems. So trichology is the study of all things hair loss and scalp. And then as a trichologist, how we practice is seeing people with any type of hair loss and scalp problem, diagnosing what their problem is, and then discussing all of the evidence-based treatment options that are available for their specific problem.
And so, therefore, in our community, women in perimenopause, menopause, and postmenopause, and they can have hormonally driven thinning hair shedding, hair loss, which I'm sure you know. Why is that?
Yeah. It relates to someone having a sensitivity, they've inherited a sensitivity to the strong testosterone that's in the skin called dihydrotestosterone. So, for someone to experience this type of hormonal hair thinning, particularly on top, first of all, you need the genetics. It's not going to happen unless you have those particular genetics. But there are other things that then can also make it occur in the presence of that sensitivity. So there needs to be inflammation, oxidative stress, and then we've got what's called epigenetics, which is really the switching on and off of genes. And so, just because you might actually have the genetics for genetic thinning doesn't mean that you actually show that trait. And that's demonstrated in studies with identical twins. So they've got the same genetics, same DNA, and one will have genetic thinning and one doesn't. How can that occur? It's the epigenetics. So generally, in these studies, the twin who did not have hair loss was doing everything that you and I already kind of know as or think of as being healthy. So their stress was low, they were sleeping well, their diet was really good, lots of antioxidants in their diet, adequate protein, lower in fat. They were exercising and, not smoking, drinking, drugs, all of that sort of thing as well. So everything we already know of as, good healthy behaviors actually can alter if these genes are switched on or off. And I think it is why maybe I actually in the clinic now see a lot more patients with this female pattern hair loss. I think that, the way our lives are now compared to maybe when my dad is a trichologist too, and maybe when he was first practicing, 50 years ago, our lifestyles have changed a lot. People are hyper stressed, all of these things. And I think that I probably see far more women with female pattern hair loss than he used to, and also younger as well. And so we can see this same type of hair loss or problem, for example, or in any age group. Normally the hormone levels are normal, but particularly another group that you can see a similar pattern of hair loss is in women who have polycystic ovarian syndrome. And it's because their testosterone is high. And in a really simplistic sense, with this type of hair loss, think of estrogen as good for the hair and testosterone as bad. So the reason why in women going through or moving towards menopause, why we tend to see this hair loss quite a bit in this age group is that our estrogen is naturally coming down, which means that the testosterone then has a greater influence on the hair. So someone maybe has never had any thinning at all their life, but then they get to this stage of life where they're having some hormonal changes, and all of a sudden we become aware, oh, you're actually sensitive to that strong testosterone in the skin, dihydrotestosterone. And now we can see, oh yes, on the top here, we do have hairs becoming finer, or it's called miniaturization, but they become finer and finer over time.
That's interesting because I thought testosterone promoted hair, well, it promotes whiskers and things, doesn't it?
Yeah, maybe where we don't necessarily want it exactly.
And so it's that the testosterone that contributes to that miniaturization of the follicles, is it?
That's right, you've got it. Yep. But you've got to be sensitive to it. So without that, inherited sensitivity, it doesn't matter. But if you happen to have that sensitivity, then it does, and we'll get the miniaturization.
Something like 50% of women will experience some form of hair loss by the time they're 50. Would you agree with that?
Yeah, I would. Absolutely.
50% of women do experience this, but the other 50% don't. So that's why, because they're not
Yes,
genetically disposed to it.
exactly. But yeah, as you said, it's a quite a high percentage. It's a huge number, and I think it's probably why in my clinic mainly I see women. Yeah, by far, 95% of my patients would be women. And I think that it's because, it's less socially acceptable to have hair loss as a woman. But also, women are more predisposed to experiencing autoimmune problems, and there are quite a few types of hair loss that are autoimmune as well. There's a different type which also relates to menopause that's worth speaking about, because early recognition of it's really important. If you're happy for me to briefly touch on that as
Yes,
well,
please.
it's a type of autoimmune hair loss, and it's a type of scarring hair loss, which means that once we have destruction of the hair follicles in this problem, it's irreversible, and it's called frontal fibrosing alopecia. So frontal, the front of our faces, often the first sign, not always, is loss of some eyebrows. And then we get a scarring loss anywhere on this front hairline. So I think if you do notice, some change in the eyebrows, and you think even that, oh, is my hairline beginning to recede and move back? Definitely seek help, and get a diagnosis as soon as you can. See a trichologist, because ultimately we want to halt this as quickly as possible because of its irreversible nature. But the reason why, women, this is a problem, rarely seen in men, mainly in women and post menopause. And the connection here is that it relates to our estrogen. So in this problem, frontal fibrosing alopecia, and also its kind of broader category of lichen planopilaris, there's actually a defect in the vitamin D receptor in the hair follicle. So, there's an issue of vitamin D here. But as women, when we go through menopause, as you may be aware, um, obviously our estrogen is coming down, but estrogen activates the vitamin D, or there's an enzyme that activates vitamin D. So we can then display with this lower level of estrogen, signs of vitamin D deficiency. It's the same reason why women are much more likely to experience osteoporosis than men. It's because as our estrogen comes down, we have less active vitamin D, and vitamin D helps calcium absorption, which is important for strong bones. So again, vitamin D, so important here. And so when I'm helping someone with that problem and treating them, I would absolutely be getting them to supplement with vitamin D amongst dealing with some other things. But it's a really important type of hair loss to discuss, because it's actually becoming epidemic. It's on the increase rapidly all over the world. Every trichology conference I go to, it's always discussed. Again, talking about my dad, just because he's been a trichologist for such a long time. But when he was first practicing, it would be extremely rare to see someone with frontal fibrosing alopecia. If you were lucky, once a year. I will see someone in my clinic every day. There are a lot of people experiencing this type of hair loss, but early recognition is the key. So keep an eye out as estrogen levels fall. And I would say to anyone, honestly, it's a good idea to take some vitamin D, especially when we go through menopause.
We are learning to find a happy medium with the sun avoidance, but do you think sunscreens contribute to that? Or we are also
Definitely.
the first generation that is coming into a time of super processed food and all the xenoestrogens and things in our environment as well.
Yeah. I think both the autoimmune problems, just in general, not even this specific one, are on the rise. And as you alluded to, our foods are different. Things have definitely changed in that respect. But then, yes, interestingly, that type of autoimmune hair loss, frontal fibrosing alopecia that we're talking about, was actually first discovered in Australia. And so, yes, in Australia we are, and in New Zealand too, very aware about being sun smart. And so we're much more likely to wear sunscreen, which blocks vitamin D as well. But, risk versus reward, we want to avoid the high risk of skin cancer down here in the southern hemisphere. So, yeah, I think there is a connection there. They also just recently queried if a particular fragrance called linalool could be connected with this frontal fibrosing alopecia. It definitely is known as being a contact allergen. People with frontal fibrosing alopecia are probably allergic to this fragrance called linalool. But funnily enough, it's also in regularly in our sunscreens. So it's interesting. I think the main thing is the vitamin D, but there are probably some other environmental contributors as well.
So vitamin D is really good for our hair. What other nutrients are very good for our hair?
Yeah, there are some key nutrients for the hair that we want to make sure don't get too low, because if they were to be too low, we could get a type of hair loss, diffuse hair loss, some shedding from all over. I would say that the big ones are, yes, vitamin D, iron, B12, and zinc are the big four, really, really important. Often see patients come into the clinic with, the most common one might be that, yeah, iron deficiency or low ferritin iron stores. And when that happens, they will be describing, oh, I'm having hair shedding, I'm seeing it in the shower, every wash, so much more than normal. And it's simply a case of us identifying that that's the problem, supplementing them to get over the threshold for hair loss, which is actually a little bit different to what's considered adequate just for general health. And then the hair loss stops about 3 months later. We always have this lag time with the hair because of the hair growth cycle. So it's always good for people to keep in mind any treatment takes at least 3 months before you can see any benefit of it.
Can you explain the hair cycle growth process?
Yeah, perfect. So we have anagen, which is the growing phase of the hair cycle. And on average, most people, their anagen is approximately 4 years or so. So most people's hair will grow for 4 years before it would naturally shed. Now, at the end of the anagen, we go into catagen, which is a very short transitional phase, and then into telogen. Now, telogen lasts around 3 months, and this is why we often have this lag time. So hairs get sent into telogen, this resting phase, and they're resting for 3 months. And right at the end of the telogen phase is when they will shed.
And what is the hair made up of? Because it's dead, isn't it?
Yeah, so hair is dead, but yes, it's mainly made up of the protein called keratin, and it's the particular amino acid bonds that help to give our hair its strength. But yes, always keeping in mind hair is dead. So when we're trying to affect the hair, it's really, the new hair growth coming out at the top, where the hair follicle is alive, that's within the skin, but the actual hair that emerges from the scalp is dead. And it's just about, managing it, keeping it as smooth as possible to prevent tangling and some of those, more superficial things to then give it the best look possible.
Because it does get drier, doesn't it, and coarser as we grow older.
Yeah, it can. And to particularly, when we start getting some white hairs, they tend to be more coarse feeling too. So you can feel that change as well. And I think that often, we are producing less sebum and oil as we age too. So you can, feel like you have drier scalp and sometimes drier hair also.
But most of it goes back to the follicles, doesn't it? Like the nutrients are what will nourish the follicles, which will mean the hair comes out more nourished. Would that be
Yeah,
a correct?
that's it. Like I guess that the other extreme of that is, if someone has a nutrient deficiency, for example, like the iron, well, their hair sometimes then is starting to grow with a completely different texture. Often my patients will describe that. And once we correct that nutritional deficiency, the texture returns to normal. Um, but yes, our hormones as well, another kind of patient story. Yeah, our hormones play a big role in the texture. And I had a quite unusual patient who, since menopause, her hair texture had changed and she'd lost all of the curl within her hair. It had changed to being quite straight, and that tends to be related to the sex hormones. Although it's not that common, it can happen.
That's interesting because I was just going to ask you about that because I met up with a lady I hadn't seen for 45 years or something just last weekend, and she's 82, and she said that her hair had changed from being straight to curly, wavy
Yeah.
now.
Yep.
Quite amazing, isn't it?
Yeah.
So, and what about shampoos and conditioners and treatment masks and all the things? Because I'm a former beauty editor, and I remember often being told that the more you washed your hair, the better. But then I read something the other day, and they were saying that you need to leave your shampoo on for 3 minutes.
Mm.
So has the story changed, or what would you
Um,
say?
I think both are correct. So the frequent hair washing is optimal. The gold standard would be every day if you could. This helps to control. We've all got these species on our scalp, yeast, bacteria, and by washing our hair frequently, it removes excess sebum and oil, also dirt, etc., product buildup from the day, and helps to prevent the overgrowth of the bad yeast that can lead to dandruff, seborrheic dermatitis, itching, inflammation. So washing the hair daily is great. It is important though that the shampoo you're using has an ideal pH around 5.5 because that then helps to rebalance the scalp microbiome. So it certainly wouldn't be optimal washing your hair daily with a shampoo that pulls you into the wrong pH. But generally good brands of shampoos should be pretty well balanced with their pH. So frequent hair washing, yes, it's ideal. And then, yeah, I often advise my patients to leave their shampoo on for 3 minutes, especially if it's got some active ingredients in there or some antioxidants, which can help to reduce inflammation. Then, yeah, make sure it's really getting in contact with the skin. Leave it on for 3 minutes and then rinse it off and follow with the conditioner as normal.
And what about the things like, our heated appliances, our hair dryers and our straightening irons and curling tongs
Mm.
and
All of that can definitely cause physical damage to the hair, damage to the cuticle as well, which is the outer layer of the hair, which can then basically lead to, think of the cuticle almost like scales on a fish. When it gets damaged, the scales are flicking in all directions, and light doesn't reflect off of it so nicely, so it doesn't look as healthy. And I guess at the extreme you end up with broken hair and split ends, etc. So being aware of heat styling, there's nothing wrong with heat styling, but I would always suggest people use heat protectant and maybe turn the temperature down if you don't have a device that's really well controlled with its heat settings. So turn it down as much as you can, just to ensure hair stays a good quality. But when it comes to, for example, going back to female pattern hair loss, the hormonal based hair loss, a lot of this needs to be treated. When I'm treating it, it's from internal generally, and you're either treating it in a hormonal sense or with growth factors to promote or try and increase the diameter of the hairs that have become finer.
to treat conditions like that, do you have things that people can take?
Yeah. Yep. So this is the sort of thing I'll discuss with my patient, depending on the severity of their hair loss, their current medical conditions, personal preferences, etc. There are medications, so there are drugs that people can take, and there are natural options too. So, for example, there are some hormone replacement therapies which are beneficial to the hair because they have more of a estrogenic effect. But there are some that would actually worsen this type of hair loss because they have a male hormonal effect. So we don't want to do anything that has that male hormonal effect. A common, like IUD that I come across, lots of women use is the Marina, and that's one that often they're using to try and control heavy periods, etc. But it has a male hormonal effect and could worsen this type of hair loss. So discussing all of that, and if it's something that is truly required for that patient, and if so, then you'd keep it and you would try and do things to kind of counteract its effect, or if they can switch what they're using or doing. So yeah, so it's the kind of hormone replacement therapy side of things. There's also natural herbs that can be used in a similar way. So sometimes I'll prescribe my patients red clover. It's a plant estrogen. So again, the estrogen is trying to counteract the testosterone or effect of the testosterone on the hair. And I'll also sometimes use a herb called saw palmetto, which blocks the conversion of testosterone to DHT in the skin. It reduces some of that conversion. So if there's less DHT around, fewer hairs become finer. There are also drugs, so like a medication called finasteride. It works on that same pathway, blocking the conversion of testosterone to dihydrotestosterone. And then other things that I talk about with my patients are minoxidil. That's more, it can be taken orally or applied topically, more on that growth factor pathway side of things. PRP, platelet-rich plasma, again, drawing your blood, spinning it, injecting platelets. So your platelets are rich in your growth factors. So that's why that can be of benefit. And low-level laser therapy too, I'll sometimes discuss. So it really depends on the patient. If they've got any contraindications, things that they shouldn't be doing with certain things, and also their preference, because always keep in mind when treating female pattern hair loss, our hormones persist. They don't just disappear. So any treatment that's effective is also going to be long-term. Once you stop doing it, you lose the benefit of it.
Right. Like so much that happens in menopause, we kind of need to look at it for the rest of our lives, I think.
Yeah.
In many cases. And what about grey hair? That comes from a loss of pigment, doesn't it? Does
That's
that stem
right.
from the hair follicle?
Yeah, we have melanocyte stem cells, and once they're depleted, they will no longer be producing any melanin, any pigment in the hair. So when we get the natural graying of the hair, that's called canites, and there's nothing we can do about that. But there are sometimes people who experience premature graying due to nutrient deficiencies. For example, calcium, vitamin D because of the calcium absorption, copper, and also iron. So again, making sure that we're getting adequate amounts of those key nutrients for pigment is a good idea as well.
Okay, thank you, Chelcey, so much for joining us today. It's been wonderful having you and learning so much.
Thanks, Jenna.
Thank you. See
Okay,
you.
see you. Bye.
Thank you for listening to this episode of Women on Fire. If you like what we share, please subscribe and give us a rating and or a review. In addition, visit our sponsor's YouTube channel at MenoMe 100, where you can subscribe and watch all of the interviews. That's the best way to support this podcast so we can continue to bring it to you. Thank you for your interest in midlife, menopause, and Women on Fire.
Let's keep this